Information in partnership with the National Parenting Support Commission. You would have noticed that we have made efforts to engage you or very important stakeholders on matters of interest to not just us here at the ministry, but of interest to you and your children. This evening, we're happy to have put together an esteemed panel who will be discussing this very important issue of you and your children's health. So we're talking about family health and in particular, vaccination. So we thank you so much for joining. And I know we're going to have a really good, robust discussions, and we're going to have good participation from you or parents. It is my pleasure to now introduce the panelists, beginning with, of course, the Minister of Education, Youth and Information, the Honorable Favour Williams. I also am honored to introduce the Minister of State in the Ministry of Education, Youth and Information, the Honorable Robert Morgan. Of course, we have our Acting Permanent Secretary, Dr. Grace McLean. There is the Acting Chief Education Officer, Dr. Kassan Troop. You have also been seeing Dr. Melody Ennis, and Dr. Ennis is the Director of Family Health at the Ministry of Health and Wellness, and we're so happy to have her with us this evening. We also have the Chief Executive Officer of the the Child Protection and Family Services Agency, CPFSA, and she's Mrs. Rosalie Gage-Gray. And I am Casey Akar, and I'm Chief Executive Officer of the National Parenting Support Commission. We do have a whole lot to get through this evening. And like I said before, I know that parents have a whole lot of questions. You want to get an opportunity not just to air these questions, but you want to hear from the authority. You want to know about the vaccination, the vaccine and the vaccination exercise that's on the way. So I am going to now invite Dr. McLean to give the welcome. And then we will also just go straight into the program because we want to give you an opportunity to hear what Dr. Ennis and the panelists have to say, and of course, to feed them with your questions. But I now welcome Dr. Grace McLean, or Acting Permanent Secretary.
Thank you very much, Casey, and you have already established the protocol of introducing our ministers, our Chief Education Officer and our Chief Executive Officer, as well as the Ministry of Health representative. So my task this evening, is to extend a very special welcome to all parents across the length and breadth of this country who are able to join us this evening as we seek to provide you with information on vaccination. Parents, there is quite a bit of misconception out there, some because of the lack of information. We want to ensure that we provide a space where you can ask your questions, you can post your questions in the chat, you can post your questions on the different social media platforms that we are streaming live on this evening. And of course, we will try as best as possible to provide the responses so you can be more informed as it relates to vaccination and its importance for us to ensure that we treat effectively with this health crisis at this time. So I welcome you all as parents. If you are teachers, many of you are parents. If you are pastors, many of you are parents. If you are business persons, many of you are parents. If you are not biological parents, there are children that you really care about. There are children in your churches, children in their non-governmental organizations right across Jamaica. There is one thing that brings all of Jamaica together, and that is education. And that is why we are making ourselves available in collaboration with the Ministry of Health and Wellness to provide you with information so you can be better informed and we can work to support each other as we collectively help to get ourselves out of this health crisis. So we are really very happy to be in this space this evening to share with you. As is customary, we start our whatever activities we are having with prayer. And we have Mr. Warren Thompson, who is one of the officers at the Child Protection and Family Services Agency. So Casey, at this time, I'm going to invite Warren to do the prayers for us, and then I will hand back over to you to continue the afternoon's program.
All right, thank you.
Absolutely, yes. Go ahead, Mr. Warren.
Let's pray. Oh, Heavenly Father and our God, we thank you for the opportunity that you have given us to meet in this platform, Lord, to discuss the issue of vaccination. I pray, oh God, that you will lead the conversation this afternoon. And I pray for those persons who have questions, they'll get answers. For those persons who have fears and anxieties, I pray, oh God, that you will speak into their situations and address them. I pray, Father, well, I thank you that there is no more powerful vaccine than the rich, efficacious blood of Jesus Christ of Nazareth. But we also thank you, Lord God, for science and the ways in which you have used the science and medicine over the years to heal and protect our bodies. So, Father, this conversation is about just that. I pray, Father, that our conversation will be frank and that there will be truth, for you require truth in the inmost part. Most importantly, oh God, I pray that even through this town hall experience, Jamaica will turn to you. For you have said, oh God, that if your people who are called by your name will humble themselves and pray and turn from their wicked ways, then you, God, will hear from heaven. You will forgive our sins and heal our land. And yes, Lord, Jamaica needs healing. Jamaica needs healing. Those persons who are suffering from COVID-19 right now, oh God, I pray that you will grant them healing. For those persons who are grieving because of COVID-19, I pray, oh God, that you will grant them comfort. Father, more importantly, I echo the sentiment of our national prayer. Eternal Father, bless our land and guard us with thy mighty hand. Keep us free, O God, from evil powers and be our light through these countless and dark hours. Father, I pray that our leaders, to them you will grant true wisdom from above, so that in Jamaica we will have justice and truth forever. We pray in no other name than the name of your Son, our Lord and Savior, Jesus Christ. Amen.
Amen. Casey?
Thank you, P.S. McLean. Thank you so much, Mr. Thompson. Of course, we have to be guided all the time by God. Thank you for your prayer. And I move quickly now to invite the Honorable Fable Williams, or Minister of Education, Youth and Information, to give opening remarks. Minister Williams.
Sure. Thank you so much, Moderator Casey Carr. Good afternoon, ladies and gentlemen. Let me acknowledge Casey Carr, the CEO of National Parenting Support Commission, Honorable Robert Nesta Morgan, our State Minister, Dr. Grace McLean, or Permanent Secretary Acting, Dr. Troop, or Chief Education Officer Acting, Dr. Melody Ennis, Director of Family Health at the Ministry of Health and Wellness. Thank you so much for being on this platform with us again. The CEO of the Child Protection and Family Services Agency, CPFSA, Mrs. Rosalie Gage Gray, all our mommies and daddies, or grandparents, or caregivers. And let me say thank you as well to Mr. Warren Thompson for that prayer, for acknowledging that the blood of Jesus does cover us, but also equally the science helps to keep us safe and healthy as well. Thank you for that. So let me say again, good evening, ladies and gentlemen. Thank you for joining us for this very important town hall meeting. As you're aware, the new school year begins officially tomorrow, with the first teaching date set for next Monday, September 6th. We are resuming school in the context of still worrying high incidence of COVID-19 cases. Within this context, And with the donation of the first shipment of the Pfizer vaccines, which is approved for children 12 years and older, the Ministry of Education, Youth and Information, in collaboration with the Ministry of Health and Wellness, launched a vaccination blitz on Saturday, August 21st into Tuesday, August 24th, with a focus on students in our secondary schools. That blitz is continuing. We saw it over the weekend as well. We also, during that time, encouraged parents who were themselves unvaccinated to take advantage of the opportunity to get vaccinated. And we're seeing families attend with their children to have their vaccinations together. This is all happening because we're not able to go back into the face-to-face mode just yet. Because you've seen, I'm sure you've seen on your televisions, you've seen it on social media, exactly where we are in the pandemic and the fact that we're dealing with a variant of the virus that the health professionals tell us is more transmissible. Our objective in the education system is to get our students back in the face-to-face mode as quickly and as safely as we can. Obviously, we have to be guided by the Ministry of Health and Wellness. And while we're waiting, our children will still have access to education via the online mode, via our learning kit, and via the audiovisual platforms that we have, much the same as you're used to in the last year. I know that many of you are parents who are hoping to see your children back in the face-to-face mode, but we're not quite there yet. We still have to wait to see how these numbers, these COVID numbers play out and what the Ministry of Health and Wellness advises us. But as I said, we're doing everything to continue to ensure that our children receive education even during this pandemic. And so we continue to implore you to still abide by the protocols. You know what they are. Let me just repeat them. It's the hand washing, it's the sanitizing, it's the social distancing, it's the wearing of masks, even at home, because I know that you have communities and you interact with other persons in your communities. We are pleased that many students at the secondary level, with the support of their parents, have responded to the call to get vaccinated and to protect themselves against hospitalization and possible death in the event they contract the COVID-19 virus. We believe it is prudent for students and their families to get this added layer of protection in order to ensure safe attendance for face-to-face engagement. We obviously are imploring our teachers as well, all the persons who work in the education sector, at our schools, whether you are the security guard at the gate who helps to take temperature and give some sanitization, whether you are the groundsman, whether you are the maintenance person, the cook, administrator, in whatever office that you work. We're also imploring those persons who work within the education sector to be vaccinated. So we would have indicated to Jamaica that students in our secondary schools, we will be looking to return them once their school achieves 65% or higher vaccination rate. We put higher because, well, 65%, how did we arrive at that? It's the national average that the health professionals have been telling us that we need to get to. Let me add very quickly though, that we note that across the world, there are many countries that have raised that number. We again are guided by the Ministry of Health and Wellness. In the event they raise it, of course, they will let us know, and in turn, we will let you know. But right now, we are at the 65% rate. So, and just to give you some numbers in terms of the number of students who would have taken up the vaccination, having gotten the approval from their parents, when we look back during the first blitz at August 27, 2021, approximately 28 students would have taken up the vaccine. So that is 4 days ago. As of today, we've added almost another 10,000, some 9,285 to that number to bring us to 37,285. And so we see where our students, they are listening to what the Ministry of Health and Wellness is saying. I'm sure they're doing their own research as well. And together with their parents, they're making the decision to come forward, and we want to applaud them for that. We want to say to your parents as well, we know it's customary that our students get registered, pick up their books and packages and meet their teachers during the weeks leading up to the start of school, and we hope you have been doing that. I know we have had to live through some no movement days, but during all of that, I'm hoping that you had a chance to have done some of this registration that you needed to do. We have advised that during this process, that our school leaders, our teachers and administrators adhere to the orders in the Disaster Risk Management Act, Order number 9, under which we're living, and only have small groups of students on the school grounds at any one time. And that they should try to process the registration of our students as quickly as possible in order to avoid crowding at the school gate and on the school compound. As we continue to battle the global health crisis brought on by the COVID-19 virus, we implore all to get vaccinated. Continue to sanitize and wash your hands, wear masks properly at all times, and practice social distancing. We're fortunate to have a supply of 3 different brands of the vaccine, and I'm sure you will be hearing much more from Dr. Ennis in her remarks and during your question and answer. So at this time, I want to thank wholeheartedly the team from the Ministry of Health and Wellness, who've been very helpful in providing us expert information that we need in our decision-making process. So thank you, and I turn it back over to you, please.
Thank you, Minister Williams. Thank you for your remarks. And, I am seeing that there are many persons already writing in the chat. They have so many questions. I believe I ended the welcome, person started to write. I know you're anxious to get your questions answered. So let us now go to Dr. Melody Ennis, who is our special guest and expert in the area that we'll be discussing this afternoon. And so may I now welcome Dr. Melody Ennis, who will give us her address on the COVID-19 vaccine. Dr. Ennis?
A pleasant good evening, everyone. Minister, State Minister, CEO, PS, ladies and gentlemen, parents, everyone on this platform. It is my pleasure to be here this evening to share credible information regarding vaccines and vaccination. We have been at the pandemic for just over a year, and I believe collectively we want it to end, and we want to get back to what we considered normal. It may not look as how it looked before, but it will certainly not be onerous and burdensome with us having to be restricted. There are lots of our pleasures that have been taken away from us, and specific to this forum is our children. Our children, we do not want them to be left behind. We know that there are other modalities of learning, but not only do we benefit academically from being in school, we understand that business of socialization, gaining our emotional intelligence, and being just rounded persons. And we all are thankful because it is the school setting that certainly made us who we are today and who our children are going to be tomorrow. With that said, what will help us to get back to the school setting face to face? We believe that vaccines at this time are the answer to the problem. Now, my disclaimer always is that I'm only talking vaccines tonight. However, we know that it's the holistic health care of the family and the child that is going to allow them to absorb everything in school. So they must be eating right, they must be sleeping, they must be getting their exercise, they must have a sense of spirituality, they must even begin to learn about managing their finances, because all of that, alongside good health through the vaccines, will make the kind of Jamaica that we want to see when these children become adults. So, Minister spoke to the types of vaccines that we have, how we will be administering, how we have started to administer, and how we continue, how we will tweak the process so that it is smoother for you as parents, caregivers. We will have that discussion this evening. I want us to be open. I want us to ask our questions, but I also want us to hear the credible information that will be presented. You have to listen so that you can hear. What we want is for all persons on this platform to go away having enough information that when they make their decision, it is an informed decision. And once they have made up their minds, they know that whichever way you take it, it comes with consequences. Whatever decisions we make comes with consequences, and you are prepared for all of those consequences. Of course, I am in health, so my worst consequence, of course, is death. And I know persons are going to say we're all going to die. Yes, we are, but we have no appointment with it at this time. And we all try to defer it as much as we can. We are putting it off. So I want you all to be very, very engaging, and let us help you to understand why vaccines at this time are the answer for our children to get back into school. Thank you so much, Lady Kesia. Over to you.
And thank you so much, Dr. Ennis. So much of what you said just resonated with me. You're speaking the language of the National Parenting Support Commission. You were really talking about that element of effective parenting we call nurturance. We talk about love and care and how demonstrative that can be through health care and making sure your children are resting and eating well. Good stuff. Thank you so much for your remarks. And I want to go straight now to our questions, because as much as we say that we will be here for 2 hours, believe it or not, we have already expended 30 minutes, and we have over just about 1,000 participants here on Zoom, but we also have a lot of questions coming through YouTube for those persons who are signed into YouTube. So then, I want to go to the very first question that I'm seeing, and this person says, good evening to you. Please let us know whether there will be any face-to-face allowance for children 12 and up in extracurricular activities in classes at any point in the school year. Speak and read children who are not vaccinated against COVID. So the question is, whether there will be any face-to-face allowance for children 12 and up in extracurricular activities in classes at any point in the school year. And she's speaking re children who are not vaccinated against COVID. So I think that question is for Minister Williams or Dr. McLean.
Okay, thank you, Kezia. Given the pandemic that we're in, I would doubt that we are going to be able to have extracurricular activities on our school grounds anytime soon. But, so that would be my assessment, unless Dr. Ennis could give us some better guidance, but that is the assessment that I would have, considering that during extracurricular activities, if you're doing something physical, generally you have to take off your mask and so on. I cannot imagine that we are going to get to that point anytime soon in our schools.
Thank you, Thank you, Minister Williams. Dr. Ennis, is there anything to add to that?
No, not at this time. I concur. We need to get those numbers up before we can consider relaxing our measures and allowing persons back into that intimate face-to-face setting.
Thank you. So the second question is, my daughter was born September 9, 2009. She's 11 years old. Is she eligible to take the vaccine, or should we wait until she's officially 12 years old?
We are waiting until she is officially 12 years old. So on the 10th of September, I hope you will be at some vaccination site. Yes.
Thank you, Dr. Ennis. You've answered that question for me as well. It would have been my question, read my 11-year-old nephew. Thank you for that. I want to just jump quickly over to YouTube. And it's Cheryl Brown Barnes who is asking, my child is a grade 6 student, not yet. Okay, it's the same question. So I'm going to Marcia Scott Beckford. My son is 11 years old. I guess it's the same question. You just got the answer. Dr. Ennis is saying you must wait until your child is fully 12 years old. A lot of 11-year-olds. So let's go again. How will you measure the 65% rate of vaccination in high schools?
The 65% rate for high schools would be measured in terms of our students. So at each school, the principal, the Minister of Education, knows the number of students who are registered in that school. And so we will keep track of the vaccination numbers and we'll be able to calculate the percentage as we go along.
Thank you. And believe it or not, all the questions so far that I'm seeing from YouTube have to do with 11-year-olds. So that seemed to have been a big item for parents. And I'm glad that has been settled. So just to reiterate, your child has to be 12 years old before he or she should be vaccinated, not 11 plus, fully 12, Dr. Ennis says, and she's the expert here. Good evening to you. I'm a parent and also an early childhood educator. As it relates to the new school term, I am a little anxious about the school term because I'm not receiving the information as to what I should expect for the new school term for my child who would be in grade 2. Well, I guess grade 2 comes September 6th. Well, I guess this is why you have joined this information session. So is there anything specific as it relates to kindergartners? And she's asking about her child who will be in grade 2 as at September 6th.
We'll ask Dr. Troop.
Dr. Troop, do you want to take that? Is there anything specific that we want to address in regard to our kindergartners? Dr. Troop?
Thank you so much. Good evening, everyone, to our panelists, of course, our parents in space. So as it relates to our level students, our minister would have sent out a press release. We would have sent out a bulletin concerning our early childhood institutions, our public early childhood institutions, our public primary and secondary institutions will operate for the new school year. which Minister indicated earlier, will commence our first teaching day on the 6th of September. And we have 3 major modalities that we are relying on now. The online modality, or what we call computer-aided learning, because we know some persons not able to be on the internet at the same time for all of the learning opportunities that they will be assigned. So the online, the offline, the synchronous, asynchronous, the many titles that we call it, that facility will be available. We have our teachers in our schools who are preparing for that. Just today, we met with our primary principals and we have spoken about having strategic leadership in place for the different modalities to make sure that the support is being provided. We will also have the televised, or what we call our audiovisual learning support for all levels as well, which means parents that we will have a television station dedicated to our primary level and early childhood. We have a station dedicated also to our secondary level institution. And we will be sending out a schedule. Just today, another principal asked us to make sure that on that schedule will include the topics that will be taught at the different sessions on the timetable. So we will have a schedule that we will send out with respect to the national standards curriculum, the time that the topic will be taught, and all of that information will be shared with our schools. We will be sharing that with our teachers. We will be sharing that in our public spaces, just to make sure that the information is properly circulated and you are fully aware. In addition to that, we are aware that we will have some students who may still be challenged. And so, like in other jurisdictions in the international space, we provide what we call the learning kits or the learning packets for children who may not be able to be online, who may not have a television set available, but learning materials will be packaged, aligned again to the national standards curriculum. Teachers within our schools will be monitoring this, will be scheduled to provide feedback. The principals will be working with you, our parents, to arrange for these materials to be collected. And they include worksheets, they include our workbooks, our textbooks, our handouts, you name it, every kind of material that is possible. We learned from last year's experience, so we have all of the materials that we would have developed archived and ready for the new school year. These are already on our social media platforms and our Educate Jamaica landing page, so our parents actually can start to interact with these materials. Our televised lessons are also archived and they're on the platform already. And so again, our parents can start to interact to give the children a head start so they can have access to these support. So that's the kind of modality case here that we have organized for our learners. And this applies to our infant school, which our babies in the 3-year-olds to 5-year-olds. We have guidelines from our Disaster Risk Management Act that I'm certain PS can jump in here, that will guide all our ECIs will operate. That is it, the private ones, the basic schools, and those kindergarten and those school type settings. There are clear guidance which allows for face-to-face engagement to be facilitated in these facilities. The DRMA speaks to what is supposed to happen in terms of staffing and grouping. For example, the children under 13 months old, there's supposed to be an arrangement of 1 adult to 5 children in the facility. If the children or the babies are over 13 months to 3 years, 1 adult to 8 children. And if they're over 3 years to 5 years, you have 1 adult, I think, to 10 children. So that is clear in the guidelines that the Ministry of Health would have published for these institutions. They also must abide the protocol, the wearing of the mask for the adult, all of those must be in place. And the Ministry of Health must assess and approve them for operations.
Okay, Dr. Troop is unfortunately having some internet challenges.
Here.
Are you back on, Dr. Troop? Kassan?
And then I think she completed the answer, Casey, unless not everybody heard.
Okay. All right. Thank you, Kastan, for that. Okay, we move now to another question for children whose parents will not have them take the vaccine and do not have access to any devices or internet. Can they be prioritized to attend face-to-face classes? Better yet, what strategy will you put in place for them? And this
Okay.
is Sophia Martindale. Thank
All
you,
right.
Sophia.
Thank you so much. So during last year, when our students were not able to go physically to school, we would have deployed the 3 different modalities to help our children still get education. Those are the same 3 modalities that will be deployed until such time as we're able to add face-to-face to those modalities. We have said that we are going to be prioritizing those students that are vaccinated. I'm sure you will agree that the Ministry of Education, Youth and Information has a responsibility to ensure as far as possible that we have our students in a safe environment and that we take them safely through the school year. We will not be denying any student education. We simply put, we will be providing education on a number of different platforms. The 3 that are available now, the online, television and radio, which we're calling the audiovisual, and then the learning kit means if you do not have access to online, if you do not have access to television or radio, I am absolutely sure you have access to your books and worksheets, and that your classroom teacher will be in touch with you to ensure that you continue to get education. So those are the 3 modalities that we will be using until such time as we're able to add the face-to-face modality. But at that time as well, we will be prioritizing those students that are vaccinated. And so we're asking parents to really consider the environment in which we're living. It's a dangerous environment from a health perspective. To date, we know we've been gathering, and Dr. Ennis, I don't want to trot on your grounds, but based on the information, we're seeing billions of people take the vaccine, and we are seeing the results of that in terms of, if you look at the comparison between vaccinated and unvaccinated, it is clear what is happening in our hospitals. So, ladies and gentlemen, parents, mommies and daddies, we are not claiming to have all the answers. We have to proceed in the most conservative manner that we can, given this pandemic, where the world over has never seen something like this before. So if we sound conservative, it's because of the environment in which we're forced to operate and wanting to keep all our children as safe as possible. Thank you, Kesia.
Thank you so much, Minister, for your comprehensive response. And we're now moving over to Facebook. Thank you to all the officers who are monitoring the different platforms. And we have a question here from Denisha who asks, what will happen if my healthy child develops complications after being vaccinated? Dr. Ennis? Oh, please unmute, Dr. Ennis. Thank you.
I am so sorry. Thank you so much for that question. Let us go back just a bit and look at who are the ones getting the vaccines and why. And I'm just picking up on a few of the questions I saw in the chat to get around to answering you. So the concern is that this vaccine might not be safe. And the question was, have clinical trials been done on children? And the answer to that is yes. And Pfizer so did those trials. Now, you will recall that when the Pfizer vaccine came out last December, it was for persons 18 and over. Those were the persons that were involved in the clinical trials. Now, under normal circumstances, we do not put children and pregnant and breastfeeding mothers in clinical trials at the beginning. Never have, never will. So the vaccine had to be given to millions of persons before they could do trials on children. And you will recall that they did trials and it was in a phased basis. They were able to tell us that the vaccine was safe in children over 16. And after that, other children, as more persons in the population got vaccinated and nothing untoward happened to them, they could gradually lower the age until the trials were done in children 12 and over to prove that the vaccines are safe and effective at preventing severe illness from COVID. So that is the background history on the safety. Now, we only vaccinate well persons. As you will recall, when you took your child to the health center for a vaccine, if the child had 100 and plus temperature and vomiting and diarrhea, kicking and screaming, nurse would tell you, no, you cannot get the vaccine today. You have to wait until your child is better. So when we vaccinate persons, we are vaccinating well people. And this is one of the reasons why vaccines are so rigorously monitored, tested, and rigorously monitored, because we are giving vaccines to healthy persons. We do not expect them to get ill. Now, there are some common run-of-the-mill side effects that we expect. We have seen them so often and we expect them. And of course, you know, again, when you took your child to get vaccinated, nurse would tell you, have your Panadol, because the baby is going to cry, going to be very irritable. However, if the baby cries uncontrollably for days, you have to carry the baby back. So you know all of those things. They're going to get a fever, they're going to have pain, the area going to be red. So all of those run-of-the-mill, what we call side effects, are known and expected. The very same with the COVID-19 vaccine. We expect pain at the injection site. We expect you possibly to get a fever, to get chills, to have headache, to feel very tired, to be sleeping a lot. And we say, you take your Panadol, you have lots of fluid, and you get your bed rest. Now, there are some very, very rare side effects that have been noted, and I'm going to speak to Pfizer because that's the one your children are getting. So for Pfizer, there is the very rare side effect. Of all the persons who have received Pfizer so far, they have noted 674, and that data is as of last week, Tuesday. So 674 cases of what we call myocarditis or pericarditis. And this is an inflammation of the muscle of the heart or the tissues that surround the heart. And children, usually it is boys over the age of 16, between 16 and 30, that's because they're giving it to older persons as well, may get this inflammation of the muscle. It is associated with chest pains, some shortness of breath, and the vast majority resolves with bed rest, some fluids, and symptomatic care. There has been no deaths to date in the 674 that I mentioned was confirmed. I want to add finally that myocarditis and pericarditis can occur from COVID-19 infection. And we have looked at the children in our hospitals that have been admitted for COVID. And we have found, I think the last stats was at 181 children, And of that number, 28 of them had myocarditis, pericarditis. Okay, so these are conditions that we see, these are conditions that we can treat. So those are some of the side effects that we want to bring to your attention at this time. Thank you.
Thank you very much, Dr. Ennis. Minister Williams, here's another question for you. If my child, or since my child will not be 12 years old before September 6th, but I'm suspecting that this parent does intend to have the child vaccinated, will he be allowed to return to school before being vaccinated? Return to face-to-face?
Is the child in the secondary school or primary school?
Right. So the child would have matriculated to high school, and the parent wants to know, but he will not be 12 before September 6th, but she does intend to have him get vaccinated. Will he be allowed to return to face-to-face?
Well, again, in terms of when exactly we get into the face-to-face mode, that is not entirely clear. We have an expectation that, we'd love to see the face-to-face mode in our high schools in October, but that is just our expectation or wish or objective. Again, we have to be guided. It depends on how all of this develops, all of this pandemic, the direction in which it goes. So we would like to, we're projecting, but again, we have to be guided. So if the child is 12 now, almost 12 now, maybe by then, the child will get to 12 and be able to be vaccinated. Is that the issue?
Yeah, yes, Minister.
Yes, okay.
Okay, thank you so much. So Dr. Ennis, I'll read 2 questions and then you may respond after. What is the sense of taking the vaccine if it doesn't prevent my child from getting the virus? That's one. And the second one is, I have a child who's 12 years old, but he has asthma. I am very scared. Well, that's a statement, not a question. So could you allay the fears of this mom, Alicia Brown, whose child is 12 years old and he's asthmatic? And then from Rosemary Green on Facebook, who is saying, what's the point of taking the vaccine if it doesn't prevent my child from getting the virus? Dr. Ennis?
So thank you again. If you have any underlying condition, be it a child or an adult, the evidence is very clear that if you contract COVID, your end result is not as good as your counterpart who does not have any underlying condition. So even in the few children that have died from COVID here in Jamaica, the majority of them have some underlying condition, be it asthma, be it bronchitis, be it cancer, but they are not fully well children. So the recommendation is that if your child have any underlying condition, those children more so than their colleagues without underlying condition we beg of you to have them vaccinated. So your asthmatic should get vaccinated. All right. What's the sense of taking the vaccine if you can still get the virus? So remember that the vaccines were primarily made to do what? Prevent severe illness, hospitalization, and death. It has also been coming to the fore now that persons who are vaccinated have a lower volume of virus in their respiratory tract, and therefore they are spreading less. Now, the vaccine protects you as a person from getting the severe illness, but the vaccines also do another thing, and that is now where we look at the greater good. So if the virus comes into me and I am not vaccinated, it stays in my upper respiratory tract, but then it moves down into my lungs and it begins to reproduce fast. And the more it reproduces, is the easier it is for variants to form, because that's what viruses do. They develop variants or they change because guess what? They're trying to make themselves relevant, which means they're trying to be able to continue to infect us. So if I am vaccinated, that capacity of the virus to multiply plenty is much lessened, and I am not a host for the possible development of variants. So taking the vaccines has a personal protective effect, and it has a bigger protective effect on the society. And that is why we're offering the vaccine at this time.
Thank you. And I have a question here from Althea Saunders of the Jamaica Observer. When will clear instructions, guidance be given to parents about the way forward for the new school year? Many aren't clear as to whether some students will return to face-to-face. The minister also said students who are vaccinated will be prioritized. What exactly does that mean? Minister Williams?
Okay, Kesia, sorry, can you repeat those questions? I just caught the last one.
Certainly, Minister. So when will clear instructions, guidance be given to parents about the way forward for the new school year? Many aren't clear as to whether some students will be returning to face-to-face. And this is from Althea Saunders of the Jamaica Observer. She also writes, the minister also said, students who are vaccinated will be prioritized. What exactly does that mean?
Okay, all right. So again, let me say, we're sitting here at the end of August, August 31. And as best as we could see into the future, what we're seeing is that we cannot begin school in the face-to-face mode. We have to remain in the online mode, in the remote mode. We still have to have lessons via television and radio, and we still have to have the distribution of our learning kits, which are books and worksheets, and students are asked to be in communication with their teachers. As we go forward, I know we will get greater clarity. We work hand in hand with the Ministry of Health and Wellness. They monitor the COVID numbers daily. They do their projections, and they will be able to tell us, give us a sense of when we can go back into the face-to-face mode. I just said earlier on that at the Ministry of Education, Youth and Information, we have a wish, we have a hope. We would love to see face-to-face for our secondary school students starting in, let's say, mid-October. But that is our hope. That is what we would like to see. But again, we have to be guided. And as we go along and we get new information, as the Ministry of Health and Wellness develops their projections, we will know. And at that time, we will indicate to our parents. In our primary schools, the situation is a little bit different because generally students in our primary schools are below 12 years of age. At this time, there is no vaccines for them. So the situation there is different. When we are able to bring the children in our early childhood sector and in our primary schools back into the face-to-face mode, we will be doing so. And you can see that in that environment, all our students will be back in school in our primary and early childhood sector. In that environment that we foresee, we are encouraging all who work at our schools to be vaccinated as adults, to protect yourselves as you interact with our children who are unable to get vaccinated at this time. So normally, when school begins, we don't have to make a distinction between primary school and early childhood sector versus high schools. But in this pandemic, given the fact that 12 and over will be are able to take the vaccines. 12 and under 12 are not. We have to make that distinction. And so we continue to bring this information to you, our teachers, our parents, persons who work at schools, all across the education sector, to say, we wish we could give you precise information, but we cannot. We can only give you, to the best of our abilities, based on guidance we would have gotten from the Ministry of Health and Wellness, and based on our responsibility as a Ministry of Education, Youth and Information, to keep our students in a safe environment to the best of our abilities. Thank you.
Thank you, Minister. And we are talking about the health of our children, and we want to make sure as a ministry that we're very inclusive. So Rosalie Gage-Gray, if you would be so kind to unmute and to give us some updates as to our children in state care, if you will. Rosalie?
Pleasant good afternoon, everyone. So within state care, we have approximately 4,600 children across all the programs that we have. We are pleased to advise that a number of our children, almost 80% of children in residential facilities, have been vaccinated so far. We have developed a protocol that governs how we do the sensitization of the children and their parents, as well as our caregivers. And so our efforts are to continue to sensitize, give them the information so that they can make an informed decision with our support to get vaccinated. So we do note that children have a right to education, and we are quite pleased with the efforts being made by the ministry or parent ministry to afford the children different opportunities so that they can continue the learning process as we go through this very serious pandemic. We are encouraging our parents to listen to the information. Dr. Ennis has been quite clear. Minister has also spoken about the whole process, that they would afford themselves and their children the opportunities to get the vaccination so that we can return to normal as soon as possible. Thank you.
Thank you, Rosalie. And now, Dr. Ennis, I want our parents out there to hear it from you, from the expert. Believe me, the question keeps coming about 11-year-olds. So maybe these persons joined late. Will you please reiterate what you said earlier about 11-year-olds and whether or not they're eligible to be vaccinated at this time? And then I have another question that says, why doesn't the ministry extend the places issuing the vaccines? I live on Red Hills Road, and there's a clinic and school nearby that I believe could be used as a vaccination site. I don't know, Dr. Ennis, if you can speak to that, but certainly I'm confident you'll be able to address the question regarding the 11-year-olds. Go ahead, please, Dr. Ennis.
Sure, thank you. The vaccine, the Pfizer vaccine, is only at this time to be given to persons who are 12 years and over. Remember, everybody just asked me before if clinical trials were done on these children, why the vaccine safe? So the clinical trials were done on children 12 and over. They are now in the process of doing clinical trials on children below the age of 12. And we have to wait on those results to see if it is safe and effective. So they are doing the work, but we have to wait. So for now, everybody, your child must be 12 years and over. That's it. Now, with regards to expansion, you know, we wish we could have a vaccination site on every corner because it is so important to get persons vaccinated. But recall, it's the same staff that we have that has to be in the clinics, that have to be doing everything, that are vaccinating, that are also testing. So we are trying to improve on the numbers of persons who are inoculating, and we are going to be going out into communities more. So hopefully Red Hills will be a corner stop shop and we will get vaccinated in short order. But please, let us make our way to the schools that are designated as vaccination sites. The Ministry of Education has so graciously, during our no movement days, allowed for some amount of transportation of persons. Call your school, get the information, see how you can get the help to get to the sites that we have currently up and running.
Thank you. Thank you, Dr. Ennis.
Casey, let me add as well that more of our schools will become available as sites for the vaccination exercise. And of course, we will communicate this to our principals, to our regional heads or education officers, to our parents, guardians, caregivers about exactly which schools those would be.
Thank you, Minister. So you've heard that there are other schools that will become sites eventually. Thank you, Minister. P.S. McLean, as you're there, and just to give Dr. Ennis and Minister 30 seconds to rest their voices. P.S., you made a really important point in your opening remarks, in your welcome actually, and you so rightly said that there are teachers who are parents too. And so often we forget that dual role, very important, that our teachers play. What have you to say directly to our many teachers who are also parents?
Right. So the Jamaican population is one that I will have to say we coexist. We carry different roles at different times. Sometimes we are teachers, we are pastors, sometimes we are aunts, we are uncles, we are cousins, we are community leaders. But all in all, we are Jamaican citizens and we want the best for our Jamaican children. I have been responding to some of the comments in the chat, Casey, and I'm seeing where some comments are posted several times because I believe that persons just want to get the answers. Yes. For example, yes. Is the vaccine mandatory is one that has been coming about 10 to 15 times. The matter regarding early childhood institutions, specifically daycare, many of our parents, and I think some of these parents will be teachers, are concerned about what do I do with my 18-month-old child and my 2-year-old child because I have to go to work. I just want to bring your attention to the Disaster Risk Management Act, Order number 9 that is currently out, which is the one that is currently being used for us to be guided for the education of our children. And I'll ask that you go to section 20, which actually details on 2 pages what is expected for daycare institutions to be open. Dr. Troop outlined the different age groups going up to 5 and under, and what is required in terms of the specifications. So I know that our early childhood institutions are concerned at this time as it relates to the daycare component of your institutions. Some information will be sent out through the Ministry and the Early Childhood Commission within the next few days for you to be guided by, but you can always refer to the Disaster Risk Management Act, Order number 9. I noticed also that many of our private institutions are concerned about whether or not they can open face-to-face. We would have reiterated on different occasions that you too must be guided. And it is stated specifically in the Act where these institutions must be approved by the Ministry of Health, formal approval, not word of mouth, and the Ministry of Education, Youth and Information for you to be open. So we always have to be guided by what is in the order. Just to mention to you that there are 2 documents that are now in circulation. There is the enforcement order, which actually covers what is in the actual order itself in terms of detail. And I know it's a little much for our parents to take in, but we are here to guide you. Minister, you would have directed us, and we have started now to send emails with information directly to parents and teachers, and where it is appropriate, even to our students. So I will encourage you to make sure that if you want us to communicate with you directly, you can make your information available through our regional offices. And there will be a call that we will be sending out by way of our website, so we can all have you as a part of our database, so we can communicate with you directly. Just to indicate also that if you are in doubt in terms of what's going to happen on the 6th of September, your school is the point of reference. We have been talking to our school principals. We met with 1,000 of our school administrators, board chairs, and principals today, where they were updated by our ministers in terms of the plans for the opening of schools. We are going to be meeting with our high schools on Thursday, and we are going to be continuing the dialogue. It's a dynamic, it's a complex system, but the ministry has over 45,000 members of staff, teachers, administrative staff, ancillary staff, as a part of the team that is responsible for our close to 600,000 students. And so the information cascades. And so if you have not heard from your school in a long time, I am sure you have a number for the teacher or the principal. You can call to find out what is happening if you have not heard anything. It is also important that at this time, you answer the telephone calls, you respond to the messages that do come to your phones. If you are not able to do so at the time when the message is coming in the evening when you're home from work and so on, please respond, because on many occasions, your principals and teachers are trying to get in touch with you as parents, and they are unable to. We have seen instances when we meet with a principal, the principal is able to say, my school population is 1,800. I have been in touch with 1,500 of the children, but 300 we cannot find. You have to assist our school's principals and teachers to find your child, to ensure that there is a customized plan for the education of your child. Parents, another 5, 15, 20 years from now, we do not want to be looking back at those children who would have been severely affected by this pandemic that we didn't cause on ourselves and say that this is a lost generation. So we are prepared to do everything that we possibly can to assist in ensuring that your children access the type of education that will make them into the kind of citizens who are socially acclimatized to a civilized society. That is what we are working towards. And parents, we are begging, we are beseeching. We need your help to help your children to become educated.
Thank you so much, PS. Thank you. Dr. Ennis, it is said that the COVID-19 does not affect children. So what data do you have to now say that children need to be vaccinated? That's one. And two, if I have high blood pressure, issues with circulation and swelling, should I take the vaccine?
So let's take the second part of that question first.
Yes.
For persons with any underlying condition. I say it again, if you get COVID, not do well, and you stand the chance of dying. So high blood pressure is an underlying condition. Circulatory problems is an underlying condition. Swelling from whatever cause may be an underlying condition. Yes, you are at greater risk of a poor outcome if you get COVID-19, and therefore the vaccine will help to protect you against the severe illness, the possible need to be hospitalized and go on a ventilator and possibly die. So those are the reasons why you should make every effort to get vaccinated. Children and parents, please recall, children have always been noted to be what we call super spreaders. And someone in the chat spoke to the changes that the vaccine is just less contagious. The contagious rate is less in children. That is incorrect. Now, children, as I said, are now being called super spreaders. They do get infected. And the challenge is that a lot of them will do okay. They will recover. But as they continue to spread the virus, remember what I said about mutations or the change that may occur if the virus is allowed to spread a lot. And these super spreaders may be the host or maybe that body in which a variant develops. And again, if you vaccinate those children, then that chance of that reproduction or massive amount of reproduction will be curtailed in children. And we also know that these are the ones that have the potential to infect older members in the society, including teachers in the classroom with the virus who may have a condition and carry it home to other persons in their families who may not do so well. So the whole business of vaccinating is to protect the individual, but it's also to protect the society. And on the heels of that is the question that there are some persons in the society who cannot take the vaccine. We know those persons. And, you know, for this particular vaccine, that number is a little higher than usual now because we have all our children below the age of 11. And that is why it is important for us who can take the vaccine to form a kind of shield, a kind of barrier around these vulnerable ones and protect them. And that is what we talk about when we speak to herd immunity. So if enough of us are vaccinated, so we have 20 persons we have 1,000 persons on this platform, and there are 10 persons in here that cannot, for whatever reason, take the vaccine at all. If the other 990 of us are vaccinated, when the virus tries to spread from 1 to 1 to 1 to 1, there is no reproduction, there is nothing going on, and it won't get to that 10 that we are protecting. So really, it belongs to us to support these little ones now under 11, under 12 that can't take the vaccine, and the others who are really, really have a health condition. And I segue into the health condition because someone keeps asking if you are cleared by your doctor not to take the vaccine. Those persons who have medical conditions that cannot take the vaccine are few and far between. Few and far between. So it is not like there's a lot of persons who will have that exemption, and vaccines over time, and these vaccines, if you have a medical condition that warrants exemption, you are exempted.
Okay. Thank you, Dr. Ennis. I have another question here from Altia. Good evening. If my child took the DT vaccine, how long after will she be able to take the COVID vaccine?
A minimum of 14 days. Any vaccine at all, you have to wait 14 days before you can get COVID-19 vaccine, and you have to wait 14 days after if you're going to take. So we know usually around this time, children are getting HPV, they're getting DT shots, they might to go back into school. You have to wait 14 days. So I'm going to ask, if you know your child got the DT shot yesterday, or well, not yesterday, but maybe Wednesday, remember, don't bother come to this school or to the vaccination site, because guess what? We're going to ask you to please return after the 14 days. So just wait out that time and then you take the child to be vaccinated.
Thank you. Dr. Ennis, Mike Angelo says the vaccines cause blood clots on the microscopic cellular level. What are the long-term effects of the clotting once your child takes the vaccine?
So, first of all, I'm not aware that it causes blood clots on the microscopic level. The AstraZeneca vaccine, the Johnson & Johnson vaccine have been shown that persons, and it's those vaccines are for persons over the age of 18, that it is plausible that persons may get a blood clot. They have looked at the kinds of clots that persons get. Those are some rare clots that do occur. It is noted. We have also been able to look at the statistics for the clots, and what has been shown is that 1 in every 250,000 persons may get a clot after AstraZeneca vaccine primarily. Now, we get blood clots in our population regularly, and on it's not foreign to us to treat. Just by way of comparison, the oral contraceptive pill that most ladies from 18 to 45 take have a rate of about 1 in 2,500 for getting a blood clot. Your doctor will tell you if you are obese, if you are 35, if you smoke, you should not take the oral contraceptive pill because your chance of getting a blood clot is very, very high. So there are, the point is that you may get a clot from AstraZeneca. It is not a long-term problem if you get a blood clot. It may be in your leg, it may be in your lungs, it may be in your brain. We treat it. You get anticoagulant therapy, like warfarin, that we treat. We tell you if you're taking this vaccine that it is plausible that you may get it. And you look out for pain and tenderness in your calf, chest pain, shortness of breath. You experience those symptoms after the vaccine. This is not the time for you to watch it like we all do here in country, watch it and say, no, you don't want to watch that. You want to make your way to your health facility, your private doctor, public setting, so that we can begin treatment. But, statistics again, if every single Jamaican took the AstraZeneca vaccine, 3 million of us, it is possible that 12 of us may get a blood clot.
Okay, thank you, Dr. Ennis. So Melissa says, since they're trying to make it mandatory for the children, is it mandatory for teachers, Minister Williams?
The vaccines, and Dr. Ennis can back me up on this. At this time, the vaccines are not mandatory for anyone at this time. Teachers, parents, students, citizens. We are appealing, though, to all Jamaicans to consider the environment in which we're living. You are seeing the news on your TV on a daily basis. You see where we are as a country. We have to go through no movement days. Our lives have been turned upside down. The things that we used to do, we can't do them anymore. We used to love to get together with friends, go out to eat, go out to dance, go out to do whatever. We're not able to do those things anymore. So while it isn't mandatory to take it, we are strongly encouraging you, because thus far, the science is suggesting that this is the best weapon that we have right now.
Minister Williams, what if my child gets vaccinated and goes to school and catches the virus? Who will be held accountable?
Dr. Ennis, can you help me out there?
Well, it is very hard to determine exactly where one contracts the virus. So We know that it's the high chance of you contracting it in a crowded setting, but to specifically say that it was the school, that may be a little bit difficult. But, you know, we really don't want anybody to be contracting this. So if everybody observes the protocols, wearing the masks properly, and, you know, we can't overemphasize wearing the masks properly, covering the nose and the mouth. Somebody in the chat said, what is the long-term effect of wearing the mask? The mask prevents droplets from leaving. The mask does not prevent oxygen from getting into your nostril and into your lungs. The mask does not prohibit oxygen. It doesn't reduce your oxygen. Contrary to what you have seen on the Encyclopedia and Medical Journal of WhatsApp, it does not reduce your oxygen, right? It keeps particles out and prevents you from spewing these particles when we speak, when we sing, when we laugh, when we shout, okay? That's what the masks do, and it is those droplets that can infect us. So we don't want to hold anybody responsible. I mean, we don't want anybody at all to catch the virus. So we just have to abide by those rules and make that decision to get vaccinated.
Thank you. How will the ministry handle children who are not medically cleared to take the vaccine due to severe medical conditions such as heart problems, cancer, epilepsy?
I am going to start that one because
Yes, please, Dr. Ennis.
heart condition, epilepsy, what was the other one?
Cancer.
Do not prevent you from taking the vaccines. Those are not, I repeat, those are not contraindications to taking the vaccine. Excuse me. There are other conditions, and we can stick with cancer for a moment. Now, if you have cancer and you are well, you're on medication and you're doing fine, you can take the vaccine. If you have a cancer and you are at this point on what we call immunosuppressive medication, and you know what that is if your child have cancer, those IV medications, then you have to have a discussion with your physician, not about whether you can or cannot take the vaccine, but is if you can take it at this time. So maybe your immune system is so compromised that you're not able to take it at this time. And that is where the discussion comes in.
Thank you. Thank you, Dr. Ennis. Research shows the vaccine does not prevent COVID. Plus, it is only effective for certain months, which means after 2 shots, boosters will be required. So why is it mandatory for children to take the jab to go to physical school?
Let me see if I got that one right. We're talking about
So I could go through again, Dr.
Go
Ennis.
through again for me.
Yes. So research shows the vaccine does not prevent COVID. Plus, it is only effective for certain months, which means after 2 shots, boosters will be required.
So that's
why is it mandatory for children to take the jab?
Well, it's not mandatory for children to take the jab, and the reason that was given to ask that question is also incorrect. There is no statement that says that the vaccines will be ineffective after 2 jabs. What the manufacturing companies, and not all of them, Pfizer came out with first mover to say that it is possible that you may need a booster shot. Johnson & Johnson just said a couple of days ago that you may. AstraZeneca said 2 days ago that you may not. They think that your vaccine will last possibly a lifetime. Now, the studies are just being conducted, but what do we know? We know that viruses change. That is how they function. They just change, right? And we know that we take a flu shot every year. That is because of how rapidly the influenza virus changes. So it may be possible that we need to get a booster shot, but it is not any fact at this time that will be ineffective after 2 shots, and we will definitely need a booster shot. That is not so. But having said all of that, let's go back to booster shots. Booster shots are common with vaccines. You know that when your child got DPT and polio, they didn't get it one time. They got it at 6 weeks. They got it at 3 months. They got it at 12 months, 18 months. They got it at 4 to 6. Those are booster shots to do what? Ensure that our immune system stays at peak. So booster shots are not anything foreign or strange to us. We know and we understand why we get them. But at this point with COVID, we are not there as yet. We're not there as yet.
Thank you. Are we to expect a drive for a jab for every new strain of the virus that arises?
No, we are not to expect a new jab, because the way it's whole heap of strains going on. So this variant, you have whole heap of variants already, but few of them are of medical significance. The Delta variant is of medical significance because it has the change from the Alpha to the Delta is such that the Delta is more infectious. So Alpha could have spread from 1 person, get Alpha, could spread to maybe 2, 2.5 persons. All right, 3. But Delta now, 1 person can spread it to 4, 5, up to 10 persons, depending on the environment you're in. So the change that happened was for it being more contagious. So sometimes they change to be more contagious and they don't trouble severity, so we continue doing what we're doing. Sometimes they change to be more severe in the illness, and it is possibly at that time that we may have to get something different. But for now, and just historically, what is in place and available can treat the variants. No.
Thank you. And I just want to say that we have less than half an hour to go. My goodness, the time has gone very quickly. It is now 7:32 p.m. by my clock, which means we have 28 minutes to go. So we're going to be sprinting now. And I want to thank you for your participation and for just, trying to get as much information that is correct from the experts on the panel. Thank you so much, parents. For clarity, so once the number reaches 65% and up, would the face-to-face be a mixture of vaccinated and unvaccinated students to be present at the institution? For clarity, so once the number reaches 65 and up, would the face-to-face be a mixture of vaccinated and unvaccinated students to be present at the institution?
So at this time, based on the information that we have, only vaccinated students will be at school.
Okay, thank you, Minister Williams. Is it that you'll be prioritizing? Okay, Minister just answered that question. Will unvaccinated high schoolers be allowed? Minister just answered that question. Will my child be allowed in school if he refuses to take the vaccine?
So recall that we've said several times that education is being delivered on a number of different platforms. The online platform, the audiovisual platform, the learning kit platform. And when we are able to add the face-to-face, we will. In that environment, if a child shows up to school and is not vaccinated, we're asking the principals to put that child in a holding area, to get on the phone, call the parents or caregivers so that they can come and safely take that child back home where education is being delivered via those other 3 modalities. And that is based on the information that we have now. Again, this is a very dynamic environment in which we are. as we go forward, I'm sure we'll get new information, new and better information to help to guide our decision-making process. But that is the best information that we have now to give to our parents.
Thank you. Can private schools go ahead and have face-to-face teaching and learning? PS, you had given some information to this regard.
Right. So I indicated earlier, Casey, to the private institutions that the reference has to be to the Disaster Risk Management Act, Order Number 9, which speaks to the fact that institutions, well, it speaks generally to institutions that will open face-to-face must seek the approval from the Ministry of Health, formal approval, which means that the Ministry of Health has to come in and assess your facility if they deem it necessary, based on where we are at a point as it relates to the pandemic. And they have to give you written approval for you to open face-to-face. What it means, an approval that you may have had last year could not suffice for you to start at the beginning of this new school year. If the approval is given for face-to-face, then this is reviewed by the Ministry of Education, Youth and Information. And there is also an education approval that is provided. But this is contingent on the guidance that is given by the Ministry of Health and Wellness.
Thank you, PS. Now, my child was vaccinated. Her second dose was scheduled for September 13, Dr. Ennis. Unfortunately, she was tested positive for COVID-19 on August 25. When should she take the second dose of the vaccine?
So, could you help me just a bit? When did she get the Pfizer vaccine?
So it says she was vaccinated. It didn't say the date, but her schedule for the second shot would have been September 13.
All right. So
on August 25th, though, she tested positive.
September 13. Let me just look.
Certainly. And while Dr. Ennis is checking on that, we answer the question about the ministry giving clearance.
Okay.
Will additional teachers be sent to work in the schools, or will it remain at one teacher to a ratio of 40 students? Remember, all protocols will still need to be practiced, vaccinated or not. So Dr. Ennis, I'll revert to you in 1 second. Dr. Kassan, do you want to take that? Will additional teachers be sent to work in the schools, or will it remain at one teacher to a ratio of 40 students? Remember, all protocols will need to be practiced, vaccinated or not.
Okay, thank you very much, Ms. Carr, for that. So what we have done, parents, is that we have been working with our principals to make sure that our schools are adequately staffed and teachers and other staff members are suitably deployed. So we have been having a series of conversations, as Pace indicated, with our principals. Our minister has been having a series of meetings with our teachers right across the 7 regions, just to make sure that all of this information is fully understood. Our schools would have organized for learning, would have requested through their regions the support staff that they will require, the teaching staff that they will require, as per the arrangements, as per the approaches that we just outlined, will be utilized for teaching and learning. And I can assure you, parents, that all our schools will be suitably and adequately staffed to operate the new school year.
Okay, all schools will be adequately staffed to operate the new school year, parents. Thank you. My child was vaccinated. Dr. Ennis, back to you.
Yes, back to
Her
me.
second dose was scheduled for September 13. Unfortunately, she was tested positive for COVID-19 on August 25. So when should she take the second dose of vaccine, Dr. Ennis?
So sorry that your child have tested positive, and we do all pray that her illness will be swift and she will recover soon. Now, I hope she would have been vaccinated on the 23rd or the 24th, and I do hope and pray that she was not showing any symptoms when she was vaccinated. Because, as I keep saying, we vaccinate well persons. But we will see if her next dose can be given on the 13th. If she's now positive, so she needs to be in quarantine, she needs to be not mixing. When that 14-day quarantine period is over, if she remains well on the 13th, she can get the vaccine, but if she is unwell, then we will defer that date until she is better.
Thank you. If teachers can go to work and they're not vaccinated, why should high school students who are unvaccinated not be allowed to return to school?
So again,
Minister
with
Williams?
with regards to teachers who are adults, we continue to strongly encourage them to make that decision to be vaccinated. Again, with regards to our children as well, it's an encouragement to parents to be vaccinated. We have a lot of information available to us. We've gotten a lot of information from Dr. Ennis just now about vaccines. As the days go by, a lot more data is being collected to give us a sense of the environment going forward. So at this point, we're simply strongly encouraging everyone. But what we're saying is education is available on different platforms. There is no one who will be denied education. But when we're in that environment for face-to-face, we are saying vaccinated children can be in the face-to-face environment. Others would need to be on these other platforms to be able to access education.
Thank you, Minister. Dr. Ennis, how long after my child takes the vaccine will I see side effects?
The side effects can occur hours after. That would be the feeling of tiredness, the possible fever, some chills. They might come in of a headache. Usually immediately, they may have some amount of dizziness. And for that, of course, you just allow them to sit or lie. Usually that happens at the vaccination site, and we're able to put them to sit or put them to lie, and that will resolve. But usually the evening of into the night after you have taken the vaccine, you may have the fever, the chills. The following day, you may get the runny nose, you may get the cough. Day 1 into day 2, you may get abdominal pain. Some persons may even notice lymph nodes, which is the wax and cannon all over the body. So, you have those in the groin, right? So that might come up. Usually all of these will go away. These symptoms will go away by 48 hours. If you're very, very unfortunate, you may have them for 72 hours. If they persist beyond that and and your child remains ill, then you must advise your medical personnel so that we can allay fears or begin treatment if necessary.
And parent Katrina Hosing, please prepare your question. And Dr. Ennis, preschoolers are unvaccinated and are not being required to wear a mask. Please answer the question about how transmission will be prevented in this group if they go face-to-face without masks.
So,
yes, go ahead, Dr. Ennis.
So, small children, it's usually below the age of 2, are not given masks. You have special child fit masks for older ones, but then masks again in that small kindergarten age, you understand. My mask is prettier than yours. I'm going to exchange masks with you, and all of that kind of thing is going to happen. And, you know, we see how it look when we wear it back ways and front ways. So it is difficult in that population. As we continue for others to be protected, to prevent them from getting ill. And we do that by all of the other ones of us maintaining those protocols.
Okay, thank you. And I'm not seeing Ms. Hosting again, or technical staff. If you're able to unmute her, then we'll invite her to ask her question. Katrina Hosting. Failing that, we will go to our other question. Oh, here we go. Ms. Hosting, are you on? You'd have to unmute. Go ahead, please, with your question. Katrina Hosting.
Good evening, everyone.
Hey.
Good evening.
So far, I've been listening to all that has been said. And is there anything that can be done to kids who are autistic? What are some of the provisions that can be made for these individuals? And this is a comment now, that these parents, they are unprofessional. They're putting up stuff in the chat that they are not listening, but they are only asking questions even before other things are being.
You'd have to unmute, Ms. Hosting.
Did you hear what I said in the beginning?
Mm-hmm.
Yes, you wanted to know what provisions were being made for children who are autistic.
Right.
Okay,
And
thanks.
I was making a statement that some of the parents, they are very unprofessional. Even before the comments were made by the officials, they started asking questions, and some of them are not listening as well. And so they tend to keep repeating the same questions over and over. And one that was said about is preschoolers, will private schools be reopened? And the answer is that your government also working in collaboration with the Ministry of Health. So you have to listen to what the Ministry of Health says. And you don't have all the answers. You're trying your best to answer the questions to the best of your knowledge. And so we also need to understand all of these things. And I hope that when they leave, there will be some clarity and clarification to all of this. However, let me go back to my question. I am doing it on a personal basis because I have a son who is autistic, but he's mild on the spectrum. And I am a professional. I am also in the classroom. So I am wondering, what are some of the things that can be put in place, because there are other parents who have children like mine. So
I think that's a really good question, Katrina, and thank you so much for your comments and for participating and for having listened actively. Thank you so much. So I am going to ask Dr. Ennis to answer, and then certainly Cassandra Troop, who is our acting Chief Education Officer, Dr. Cassandra Troop, to talk about the provisions. Okay, so Dr. Ennis.
So my first question is, how old is your child that is autistic? If he or she is over the age of 12, we will want to make the effort to vaccinate that child. If it's an older child, we know some of the autistic children, as they get older, they are still children. So if he's over 18, we would want to consider the one-shot vaccine for him or her. We know that these children are particularly challenging. They are sensitive to different persons, to light, to sound, and their behavior might be disruptive in a particular health facility or one of the blitz operations. So what we have done, and what we started with some of the autistic children, if they can be taken in a car, we do vaccinate them in the car at the Mona Aging and Wellness Center. So if you have a pediatrician, if you're in Kingston, I'm saying if you're in Kingston and its environs, and you have your pediatrician can advise you, or you can let me know when you are willing, if you can get your child, if the child is over 12, vaccinated at Mona Aging and Wellness in the car, in a kind of zone where he or she may accept the vaccine. So that's what's happening for us on the health side. Over to you, Dr. Troop.
Okay, thank you very much, Dr. Ennis. And again, I want to reiterate what Casey has said, Katrina, for listening and for helping us to get the message out with respect to those parents who are not hearing what we are saying in terms of the clarity. So again, I want to thank you for that. So yes, we do have a suite of support for our students who will require special education facilities. We actually, at the Ministry of Education, we have a special education unit staffed with specialists. We have also extended that to the regional offices. We have special educators in our regional office. We call them our special needs coordinator. They are also supported by our diagnosticians, our clinical psych, our educational psych persons, and those persons also provide assessment support, referral support, placement support. So we have a suite within our special education unit right now. A series of training sessions are being conducted with our teachers across all those facilities yesterday and today. And we continue to provide training support for parents. So we have created groups for parents to support them based on the different challenges that the parents are having with respect to the diagnosis for their own children. So we have those groups going. So I'm going to ensure that Casey, we get this parent's number and so we can make contact to ensure that she's getting the support. In extreme cases, we provide for our families shadows and caregivers to support those children within the schools that they're in specialized setting. And since COVID, Katrina, we have also extended these caregivers to the homes of parents who need the support to make sure that these children are supported given the kind of diagnosis that they have. We have also, in many cases, placed a number of students, again, in specialized institutions. So where we don't have our public educational institution providing the technical care and environment for children, we provide placement for them. And this year alone, we have already approved a total of placement that will impact about $44 million concerning just placement of students in specialized institutions to include those who are diagnosed with autism. We have also covered a cost of about $12 million already just for shadows for this year for those parents who have come into us, who have been asking for support, and we continue. So once you call us, we have an officer work with you, look at your particular case, and then we provide the necessary support that you need. We never turn back a parent with respect to this situation, never. Whatever support that is required, my permanent secretary said to me, Dr. Troop, we have to find it in the budget. So even if I don't have an approved budget, once that request comes, we make the adjustment to make sure that our special needs students are catered for, are provided with the training, are provided with the support. Even with our international partners, we are now developing accessibility tools to be able to utilize on our platforms as students who need that. So that's a kind of suite that we now offer. So Casey, I would be happy to get the details for this parent. And what we will also do, Casey, is to promote some more the details concerning how to contact our special education department for those parents who may need that kind of support. We never turn back any parent that requires this kind of support.
Unmute, Casey. Unmute.
Thank you, Piers. Stephen Tolo, are you ready with your question? Stephen Tolo, go quickly, please. We're just about 5 minutes away.
I'm sorry, Casey. Somebody wrote in the group, but I will get my child vaccinated tomorrow. If you answer this question, are all the panelists vaccinated? Yes, I am. And Dr. Troop is, I know Dr. McLean is.
Yes,
Dr.
am,
Ennis,
Minister.
and yes.
I am fully vaccinated, Minister. And
I am too. I am
I
too.
took my children last week to get their first dose, and we have the appointment for September 12th to get the second dose because they're high school students.
Okay. Similarly,
So-
my
so
children
that
are
that
two
parent is-
daughters. Yes.
We have to hold that parents to it now, you know. So to get name and address and everything to make sure that they turn up tomorrow. Right. Thank you.
It's Abagay. Abagay. We're holding you. Abagay, we're holding you to it.
Thank you. So Abigail, yes, you will have your children who are eligible to be vaccinated. I just want to answer Eleanor Sutherland to say, Dr. Ennis has said, and I just want to reiterate, that your child has to be 12 years old to be vaccinated. So all parents who are still concerned about children who are 11 plus years old, Dr. Ennis has said very, very clearly that your children have to be fully 12 years old to be vaccinated. So Stefan Tolo, I'm not hearing from you. So Regina, if you're ready with your question, we can squeeze in one, Regina. We can squeeze one in.
As Regina unmutes to speak, I'm going to answer the question in the chat about the ingredients of the vaccine. So the Pfizer vaccine, it contains the messenger RNA that codes for the spike protein of the virus. It doesn't contain the virus at all. It contains some lipids. Lipids are fats, and this is the nanoparticle that the messenger RNA is wrapped in. So that's what that is. It's just the lipid to be able to get into our system. It has some sugars in it, like sucrose. It has salts in it, like sodium and manganese. So those are the ingredients or what makes up the Pfizer vaccine. There is no animal product in it. There is no blood product in it. It has no preservatives in it. Okay, so it is the messenger RNA, the lipids or fats, the sugars and salts.
Mrs. Williams, is it vaccine over education? I would like to know, ma'am.
Sure. Again, we would have taken our children safely through last year on the 3 platforms on which we delivered education. Those 3 platforms continue to be available again this year as we live through the pandemic. Even when we get to that stage where we're able to bring back our high school students into the face-to-face mode, if we are in that point where it's still dangerous, then we would ask our children who are not vaccinated to be on these other platforms. No one is being denied education. Education is being delivered on a variety of platforms for our students. And at the Ministry of Education, Youth and Information, we will continue to do everything we can to reach all our students within the context of our budgets for education of our students.
And Minister, I want to give you the final question. Minister Favour Williams, vaccines are not mandatory. So why are children who refuse to be vaxxed being discriminated and segregated? Why can't we roster vaxxed versus unvaxxed? 1 week off, 1 week on.
I'm going to ask Dr. Ennis to help me because the whole issue with this pandemic, with this COVID-19 virus is its transmissibility. The possibility of going from one person to the next. And we're seeing that we're at a stage where this variant, the COVID-19 variant, according to our health professionals, is very, very transmissible. So I don't know that that scenario will necessarily work for us, but Dr. Ennis, if you could help me here, that would be good.
But Minister, this is before Dr. Ennis comes. I really wanted to just speak to and just let's wipe that out, discrimination and segregation, because we did speak to different ways for your children to access schooling come September 6th. And I just want to give you the opportunity to just speak once more to that. So no parent out there feels as if this is discrimination or we're segregating. I really want
So it's interesting, Kezia, that last year, nobody said that word, right? Everybody understood that we were going through the pandemic and that we were asking their children to be at home and access one of the three modalities. We're even in a worse place in this pandemic. The good news is we have the vaccines to help us to reduce the risk if we contract the virus, to reduce the risk of ending up in the hospital or dying. We are saying to all Jamaicans, but especially to the education sector, please make the decision to be vaccinated. So I don't know what else to say after 2 hours on this platform, other than to say we're not denying any child education. We have different modalities through which we're delivering education. And in this pandemic, in the worst part that we've seen so far, we have to make these kinds of decisions as we go forward.
Thank you. Dr. Ennis?
Minister have said it all really, but I just want to say it's life, everything else. We want this Jamaica and all its population to be alive. Well, that is my mandate, to safeguard the health of the nation. So if it means that it's vaccines that can do this, then that is what we are advising. We have the evidence at this point that that is the way to go. It remains a choice. Vaccines are not mandatory, but we in this country understand the benefits of vaccines. We have used vaccines all of our lives. We will continue to use vaccines. And therefore, this particular vaccine or these vaccines that we have undergone the same rigorous investigative, all of those words that come to ensuring that the end product is safe for persons. These vaccines have undergone them. They have been approved by their own regulatory authorities in their own countries of manufacture, but we didn't take them like that. We have been with the World Health Organization and PAHO over the years, and we recognize how they look at, how they monitor, how they critique what these companies have done, what these stringent regulatory authorities have done. And when they put their stamp of approval on a medication or a vaccine, that is when we here in Jamaica will take it on. So there are many vaccines out there for COVID at this time, but the few that have been granted approval by the WHO are the ones that we have. So you have the manufacturer's seal, you have the stringent regulatory authorities seal, you have the WHO PAHO seal. So the vaccines that we have at this time, they are safe, they are effective, they will help to prevent the spread and the severe illness that we are undergoing at this time. I want persons to continue to seek out credible information, to not be, blind or deaf to what's being said. A lot of persons come on these platforms and they're not really hearing the information. They come and they make statements that they're locked out. Now, that's fine. There are going to be some persons who will never take the vaccine, and that's all right. But the persons who are undecided, and really want credible information, I encourage you to seek it out, get it, so that you can make your informed decision. Thank you.
Thank you, Dr. Ennis. So I'm going to go very, very quickly because we're out of time. It's 5 minutes after 8, but GIS, I'm really taking back the 7 minutes because we started 6:07. So we're going to go very quickly. Rosalie, one sentence only. We're in education. We like to talk. I can tell you, very guilty. But Rosalie, one sentence. Please unmute. Please unmute, thank you.
Sorry, right. We're saying very informative session this afternoon, evening, sorry. Hope our parents were listening, and we are saying make the best choice for our children. We always act in their best interest. Make this choice for them to live. Thank you.
3 or 4 sentences, 3 sentences and a phrase fragment. Okay, so I'm going to grade everybody at the end privately. Kassan, one sentence, please, in the interest of time.
My sentence is, parents, get in touch with your schools. It's very, very important. Don't just rely on what you see being circulated in social media. Be in touch with your school. That's the safest and the best way to get the learning program that has been designed for your student with respect to the modalities that you will choose or that will be available to you based on your context. So please, Casey, grade me. I think I just failed, but please get in touch with your schools. Very important.
Oh, okay, a whole paragraph, that's okay. Yes, I'm going to be grading like I've graded my CAPE students back in the day. P.S. One sentence.
Well, I am a doctoral student, Casey. So I want to say to the people of Jamaica, the education system has developed a plan led by our minister. We presented the plan to all our stakeholders in July of this year, which also spoke specifically to recovering the learning loss. The crisis has worsened in Jamaica, and we have pulled out this component of the plan for implementation on the 6th of September. So Jamaica, we are assuring you that the plan is a solid plan based on research, technical expertise within the ministry, and approved by our minister and minister, of course, by the cabinet of which you are a part. And so you are in good hands as we roll out what we think is best at this time for the education of our children. And as we continue to lean on the Ministry of Health for direction and guidance in this health crisis, we will roll out other aspects of the plan. And in the end, it is in the best interest of educating our Jamaican children.
Okay, thank you, PS. But I heard the disclaimer at the beginning. Still going to grade your PS after. All right. Minister Williams, the floor is yours.
Okay, thank you, Casey. Let me say thank you to all our parents, mommies and daddies, our grandparents, caregivers who've been on this afternoon tonight for these past 2 hours, asking their questions and really listening to the answers. And we hope that that will help you to make your decision. As the education sector, we have the best interest of all our children at heart. We are going to ensure in the coming year, as we live through this pandemic, that all our children continue to have access to education. And so we continue to do all we can to keep our children safe during this pandemic. And so our decisions are guided by that. And I want to just thank Dr. Ennis for coming on and giving us of her expertise again. And I want to wish everyone a safe journey, a safe night, and thank you. And we will continue to bring you information to help you to make your decisions. Thank you.
Thank you, Minister Williams. Ladies and gentlemen, parents all, this has been parenting and education and health. I mean, what a wonderful session it has been. We've extended 2 hours. It really didn't feel like 2 hours. You really participated. You asked some really good questions. And of course, we had put together a good panel and you had the expertise from Dr. Melody Ennis. Please continue to follow the information that you can bank on, the information that is credible. I know that in the information age, everybody is an expert, but please go to credible sources. There's nothing wrong in reading up and then going to the sources to find out what you need clarification on, what needs to be further explained. We have totally enjoyed sharing with you this evening. As the Ministry of Education, Youth and Information, the National Parenting Support Commission, we are totally, and the word evades me, that means I'm getting old, but we're committed, that's the word. We're totally committed to serving you in this way and to coming to you so that you can have access to us. We really want parents to be involved in this process called education. So thank you. Remember to stay safe, please follow all the protocols. And we want to start off this new school year well. We want to start off on the right footing, parents, and much of that really depends on you. So please do the right thing. Get your children vaccinated. You get vaccinated as well. And let us do what's in the best interest of our children, who we all love very much. Thank you so much, Jamaica. Have a really good evening. Be safe. Thank you, JIS. Thank you. Thank you, everybody in the background. Thank you. And thank you, panelists.